Hello everyone, welcome to sqadia.com, and in this section of our lecture topic benign conditions of the ovary and pelvis, we will talk about ovarian cysts and endometrioma. We will talk about different types of the ovarian cysts, in which we have corpus luteal cyst, functional cyst, theca lutein cyst, and the corpus luteum cyst. So functional ovarian cyst is the follicular cyst, corpus luteal cyst, theca lutein cyst, and also it includes the luteomas of the pregnancy. So corpus luteum that develops during the pregnancy, it's the most common type of the cyst during the reproductive years. And all of them are usually benign and asymptomatic. They don't have any symptoms on presentation. Here in this diagram, you see the functional ovarian cyst. You can see this fluid-filled cyst in the ovary. So functional ovarian cyst can be follicular, it can be corpus luteum, it can be theca luteum, it can be luteomas of the pregnancy, which is most common type of cyst, luteomas of pregnancy in the reproductive age. First, the follicular cyst. Follicular cyst is defined as a cyst more than 3 centimeter in diameter. Most common type of functional cyst is the follicular cyst. It's very rarely its size increases more than 8 centimeter, so it's not more than 8 centimeter. Between the 3 and 8 centimeter is the size. It is usually the cyst, follicular cysts are lined by the granulosa cells. Usually they are found on pelvic examination. When the examination is done, usually the follicular cysts are found. And follicular cysts usually resolve on its own within 4 to 8 weeks. If there are any symptoms, expectant management can be done, but usually it takes 4 to 8 weeks to disappear. Or it may rupture, or it can cause torsion. Torsion is twisting, so when it twists, then it causes severe pelvic pain, and it's an emergency situation. So complication, if it occurs, which is rupture or torsion, then emergency treatment is recommended, and usually it's very painful. So follicular cysts are the most common type of cystic functional cysts in the ovaries. Size is between 3 to 8, and usually it's found accidentally or incidentally on pelvic exam, usually resolved within 4 to 8 weeks. Here in this diagram, if you see, this is the normal ovary, fallopian tube and the normal ovary, but here it's a big follicular cyst. Big follicular cyst is present here. So on pelvic exam, this big cyst cannot be usually missed. Then the other type of cyst is the corpus luteal cyst. Corpus luteal cyst is less common than the follicular cyst. Follicular cyst is the most common type of the functional cyst. So corpus luteal cyst here, again, this is the corpus luteum cyst. And if the torsion occur or twisting occur, this is the serious complication. It can cause very bad pain here. It may rupture, leading to hemoperitoneum. So same as the follicular cyst, corpus luteum cyst can also rupture when they get big enough. They rupture, and it can cause hemoperitoneum or appearance of blood in the peritoneum. Usually requires surgical management when twisting or torsion or rupture occur. And if it's unruptured, usually it may cause pain and bleeding into the ovarian cyst cavity. In the closed cavity, it can cause the bleeding if unruptured. Now the third type is the Theca lutein cyst. Theca lutein cyst is the least common. So first we said was the follicular cyst, most common. Then the corpus luteum cyst was the second, and then the Theca lutein cyst is the least common cyst. Is usually bilateral, so it is present on the both sides. It is usually due to overstimulation of the ovary by HCG, human chorionic gonadotrophin. If it is increase in level of HCG due to some condition like hydatiform mole, multiple gestation, usually it can cause Theca lutein cyst. So common causes of increased HCG can be pregnancy, normal pregnancy, it can be due to molar pregnancy, choriocarcinoma, multiple pregnancy. Usually all these have high levels of HCG, and high levels of HCG leads to the formation of Theca lutein cyst. And clomiphene is also used to cause ovulation, which sometimes can lead to multiple gestation, and this also leads to Theca lutein cyst formation. Usually it can be large enough up to 30 centimeters. So it can be big enough, about 30 centimeter, and can have multiple cysts, and it usually regress or disappear on its own. So here you can see these are all the cysts, Theca lutein cysts you can see on the ultrasound, Theca lutein cyst. Then management of functional cyst, we went over 3 types of the functional cyst: follicular, corpus luteum, and Theca luteum. If they are present, what is the management? Usually it can be just expectant, because we saw usually they regress or disappear after some time. But if they can lead to some complications, usually treatment is recommended. Watchful waiting, combined oral contraceptives can be used. Surgical management is indicated if cysts persist and if there is a rupture or torsion. So all these can be used as a method of treatment for the functional cysts. Next is the endometrioma. Endometrioma, most common site of involvement of endometrioma is the ovary. Endometriomas are pseudocysts formed by invagination of the ovarian cortex sealed by adhesion. So pseudocysts, false cysts, and they are caused by the invasion of the ovary stroma, and this ovarian stroma then is encircled by the adhesions forming the cyst shape. They may sometimes completely replace the ovarian tissue. They can invade and cause replacement of the normal ovarian tissue. Usually cyst walls are thick and they are fibrotic, and if usually on ultrasound there are it can be anechoic, means no echo of the cyst is present, or there may be low level echoes are present. So it can be anechoic, no echoes, or very low levels of the echoes are present. It can be fluid filled or debris filled cysts, usually in 0.3 to 0.8% of the cases. These endometriomas can lead to malignancy, and there is malignant transformation. It can be unilocular or multilocular, and there are thick septations present in the unilocular, multiloculars, multiple cysts are present. Septas are also present for the partition. Can lead to malignant transformation in 0.3 to 8%. Management can be medical or surgical. So that was all about the functional cysts and endometriomas of the ovaries. So thank you for watching sqadia.com.